The nursing category is cardiac. The Nclex category is health promotion and maintenance. A nurse is performing an initial assessment on a 35-year-old patient with heart disease. The nurse hears a systolic click, which sounds like a high-pitched sound during the late part of systole. The systolic click heard on auscultation most likely indicates A. Mitral valve prolapse, B. A normal heart sound, C. Increased blood flow through the heart chambers, D. Pulmonary hypertension. Again, a nurse is performing an initial assessment on a 35-year-old patient with heart disease. The nurse hears a systolic click, which sounds like a high-pitched sound during the late part of systole. The systolic click heard on auscultation most likely indicates A. A mitral valve prolapse, B. A normal heart sound, C. Increased blood flow through the heart chambers, D. Pulmonary hypertension. The correct answer is A. Mitral valve prolapse. When auscultating heart sounds, the nurse may hear a variety of different sounds. Some are normal parts of the heart's anatomy, while others indicate an abnormality. A systolic click is a high-pitched sound that is heard at the late part of systole. When this sound is heard, it can indicate mitral valve prolapse, causing abnormal blood flow through the heart. This has been another episode of the NRSNG Nclex Question of the Day podcast. For free Nclex and nursing school cheat sheets, head over to nrsng.com/freebies. Thank you so much for being a part of the NRSNG family. We're all in this together, and you are the heart and soul of all we do. The best thing you can do to help the show is to share it with a friend and subscribe. We love you guys. If you need anything, just need to vent, or want to touch base with us, email us at contact@nrsng.com or anywhere on social media. Again, head over to nrsng.com/freebies. You guys know what time it is. It's time to go out and be your best self today. Happy nursing, y'all.